date is February 17th, 2015. We're here with Jeff, and this is sort of like a virgin video because I didn't video him the first time. He just had all kinds of bad stuff going on in his body, all kinds of inflammation. I said, go see a dentist. I think you got a problem in a tooth. And he hasn't told me anything yet, so this is totally unscripted. And he's going to tell you what happened. And I don't know what he's going to say. Go ahead.
I came in, I had been suffering for several years, saw doctors, saw my dentist on a regular basis, like many people do. Nothing was wrong with me according to these people, but there was something wrong with me. I mean, just because I felt horrible. Came in here, you were able to diagnose pretty much just by interviewing me and then just doing a little hands-on exam using kinesiology. And within a few minutes, we were not here long, you were able to identify I had an infection in my mouth, in my jaw, and normal dental x-rays did not find it, but further dental x-rays did.
Normal x-rays didn't find it. That's interesting.
Well, meaning you get an x-ray once every year,
yeah,
or every other year from your dentist.
So continue.
I had done that, regular dental visits, and it was behind the ability for the x-ray to see it, further back in my jaw. A more extensive x-ray was done using a 3D x-ray machine. There it was, big cavitation, horribly infected tooth, and I have subsequently, having had it removed, many, if not most of my symptoms have disappeared, have receded to some degree, and to some major degree. And so for that, I'm very grateful, because, it kind of makes me feel better.
You wouldn't have believed that beforehand, would you?
I would not have guessed it was a tooth, because I see a dentist 4 times a year, teeth cleanings, I take care of my own teeth in between those. Would have never guessed it was in my mouth.
Does it surprise you that I was able to pick this up and the other dentists had never seen it?
Dentists, doctors, nobody called it. You have good intuition, very good ability to identify certain things and then to follow through proactively with the kinesiology. I actually did some physical testing, a doctor that actually touches you, how rare. And yeah, I'm very grateful. I'm very pleased and very grateful.
Thank you for that. I may post this on YouTube?
You may post this on YouTube.
Thank you. Let me ask you this. If you had 10 points of discomfort, symptoms, not feeling well on a scale of 10, and 0 is you're feeling perfect, in other words, all of the discomfort fell down to 0, what number would you give me now?
4.
60% improvement overall.
That's right.
Just with this?
Just with this.
Okay. I'm satisfied with that.
I'm grateful.
Okay, now we need to clear up other stuff. Now we go for fine stuff like nutrition, toxins, etc.
Exactly.
And I think I told you in the beginning, when I find an infected tooth, I stop until that's fixed. Remember?
And it's fixed.
And it's fixed.
It's gone, but it's fixed.
Okay, now we can go after the other stuff.
I'm curious to find out. I really am.
Okay.
And I brought some questions.
Thanks.
All right. Thank you.
Jeff, you were saying at one time your lips, what were you saying before
the inflammation had gotten so far out of control that my whole body had inflammation, but it was in my ears, it was my lips, it was generally my fingers and my joints, and
they all swelled up too, didn't they?
They all swelled. I mean, I was horribly uncomfortable, if not in pain at times.
And the doctors had tried giving you drugs, right?
No drugs, no.
Oh, okay.
I didn't go that far. I don't take pills.
Did they try?
No.
Oh, they didn't. Okay, but they said you're okay. They can't find anything.
Right. I mean, I went to doctor after doctor, switched doctors from Oregon to California. I was looking for a little higher level of care. Well, actually moved down here from Oregon for a higher level of care.
Just think, if you were a woman, they could have called you hysterical.
Right, they might have, right. I was hysteria, and they probably still would. in truth, yeah, no one believes. When you're in that kind of pain, and the doctors, no one believes
if they can't see it.
Right, and if they can't touch it, and if it doesn't fit in their box. Here's the problem, as I see it. All doctors coming out of medical school, regular medical schools, think within a box. It's all within a box, and they live in the box, they think in the box, they exist entirely in their box. And so if you have something that's out of the box, you're never going to get a diagnosis, because they're not willing to do it. It's got to have a language that they were taught in medical school. If there isn't a word or phrase for it, they're not going to brainstorm it with you. They're not in that business. You got 15 minutes in a doctor's office, and most of it, they're just looking to get rid of you. That's my experience with doctors.
Did you feel that in any sense, in any way, when you came here?
No.
No.
You're all business, but your business is healing. That's what you want.
That's what I want. I live for that.
Right. If your business is healing, that's great. Their business is billing and insurances and what they have to do to keep their practice floating has nothing to do with their medical license. So by the time you get down to the 5 minute of medicine, they're not practicing anything.
Our bottom line in this office is getting a result.
And you got result, and I'm happy to be on YouTube.
Good, thanks.
It all started for me when I started getting inner ear swelling, and it was painful and disorienting. And I went to regular doctors, and they gave me cortisone and eardrops kind of thing.
So you did get drugs. Continue.
Oh, that was a drug, yes.
Okay.
Eardrop.
Yes.
It's not a pill. And it worked. I mean, to topically apply that reduced the swelling and, made me feel less horrible. But it didn't, it kept on recurring. And how many bottles of these cortisone eardrops do you want to put in your ear?
And what did I show you about the tooth chart in relation to this? This was tooth number 16.
As you were brainstorming with me here in this office, I started talking about this inflammation that I was having in my ear, my jaw, my mouth, and you just immediately identified very quickly, within moments, that it was tooth number 16, and you referenced it to the kinesiology chart and the dental chart, and you did some tests. There's the chart, the answer key.
This is tooth number 16,
Lower.
right here. And tooth number 16 is related energetically in German acupuncture to the meridian of the small intestine and heart, and the small intestine happens to wrap around the ear and control the inner ear from my perspective, which is why I went right to it, and lo and behold, it was there.
And it was there, and they pulled that. I mean, it was horribly infected. I mean, it was when they expressed it with pus. It was horrible, and I even waited a little too long. Truth is, I waited a month. I was kind of a little bit in doubt, but it got worse and worse, and finally I saw the dentist. They sent me in for a broader X-ray, a more complete set of X-rays, and there it was, just this hollow, horrible tooth and jaw, and they pulled it out, and improvement almost within a week.
Excellent. Okay. Now, for the viewer, you're back again because there's still some lingering symptoms, mostly on your left side. The swelling in your ear is gone, the swelling in your joints is gone, but you still feel that there's a problem mostly in your left side, correct?
Mostly the joints do get stiff and painful, and the left foot, which was one of the original problems, and I've associated with it fairly with gluten, and I have been gluten-free for a long time before I met you.
How about dairy?
I'm horrible with dairy. I eat cheese.
Okay. Hey, everybody, look at this man. It just so happens that dairy cross-reacts with gluten.
I love Strauss milk.
So we're going to be looking into that, okay? But you need to know that. And there is a test that can confirm that.
Oh, really?
A lab called Cyrex Lab, CYREX, does a test. And I'm going to give you a handout that shows you that dairy cross-reacts with gluten. Now, what happens if you eat gluten?
Oh, I get horrible stomach issues and
Bingo!
loud, noisy.
So you are gluten sensitive. You've been off of gluten, but you're eating a lot of dairy.
A good deal more dairy than I should. Third of my diet.
A third of your diet.
I eat cheese. I mean, wonderful cheeses.
Hey, look, I'm not knocking that, but what is it? I mean, this might be the first time you've heard that dairy cross-reacts with gluten. Now, how does that make you feel in terms of what's going on? Is this the first time you heard it?
No, not the first time. You mentioned it our first meeting, and I wanted to ignore it. It was hard enough giving up gluten. I'm East Coaster, a lot to do with bread, pizza, things I like. It was very difficult, and then to really dive into where gluten exists in everyone's diet, it's pervasive. So giving that up was very, very difficult. But I did it, and I did it to a T, meaning
So are you willing to give up dairy now to a T?
I'm going to have to try because I got to figure out what's going on. It's affected, everything has affected my immune system. You know what happened to me this year? I got bit by a tick. I've been bit by ticks before. I've never had a problem. This got infected. And the infection turned to cellulitis. I ended up in the emergency room twice on 3 different antibiotics, finally with an intravenous antibiotic of vancomycin. And they were able to clear up this horrible, horrible infection. And
When did that happen?
January this
Guess
year.
what? Have you been to my YouTube channel?
No.
We had a woman who used to work with us who had a horrible cellulitis after a tick bite. Horrible. It was rampaging. I gave her 1 treatment of ozone and it was gone in a day. It was regressing within minutes after she got done the treatment.
I can't remember. I was on 3 different antibiotics. The first one for a day, but it did so little. I mean, the infection had spread so horribly.
Why didn't you come to us? Never mind. You don't have to answer.
It takes weeks to
It's
get
the
an
box.
appointment.
You're still
Yeah,
thinking
I'm
in the box. And it doesn't take weeks to get an appointment here when you're a patient.
Okay.
When you're a patient and you're sick, you'll get in minutes.
Okay.
We serve our patients.
Okay.
All right?
I consider myself a patient.
Hey, you are.
Yeah.
Okay.
All right.
Thanks. Just again, for the viewer, this is where ozone and oxidation come in and ultraviolet blood irradiation therapy. You had a rampaging cellulitis from a tick bite, which is not unusual. And in my opinion and in my experience, this could be cured in 24 to 48 hours, if not sooner.
It took 2 weeks. The side effects of vancomycin were devastating for me. I felt just as crummy for weeks after. I mean, it changed everything. The taste in my mouth, everything.
Of course.
I was on 3 different antibiotics. It was a horrible experience. It was a horrible experience.
Thank you. Continue. I forgot to mention to the viewer, you did have a couple ozone sessions, not after the tick bite, but last fall, before you had the dental work, right?
Correct.
What did those IV ozone sessions do for you?
Overall, and over a period of time, I noticed that the general reactive of my body to swelling was lowered. So meaning I had a higher tolerance to whatever environmental allergy or food allergy I have, and I'm certain it's gluten and other foods. And it just kind of brought the thing to a more tolerable level.
It modulated.
It modulated.
That's the term we use. It modulated it. Instead of being too overreactive, it was just overreactive because you were doing the wrong thing.
And it's lasted now for what, 6 months?
6 months. So it was a lasting effect from the ozone.
For me.
And you're back for more.
I am back for more.
Great. Jeff laying on the table here because
You're up.
he told me, I mean, we're trying to go after some discomfort that he's got behind his left shoulder. And I took a detailed history. Again, I'm looking for interference fields. And we found out that he's had a single surgery. And that surgery is on his neck, and we can see the scar right above my finger. So we're going to inject that with some Procaine. But Jeff, before we do that, tell the viewer what happened to you during that surgery and what that meant to you psychologically.
That was the most painful experience I've ever had in my life. Not during the surgery, but post-surgery. In the hospital bed, I was writhing in pain, pumped with morphine, and there was no relief. And my brother watched it, and he said, for 2 days I laid there writhing, incoherent, in absolute agony.
How old were you
49.
when that happened?
Yeah.
Okay. How old are you now?
53. I was
Okay.
probably 45. I say
45.
45.
Okay, and that happened before this inflammation happened on your body, correct?
Yes.
Okay, thanks. We're going to go ahead and inject that with some Procaine.
That was all previous.
We just injected that scar. Jeff, can you sit up?
Oh, yeah.
Please sit up. Now, you were having a lot of pain in your left shoulder. Move it around and tell me what you're noticing.
It's tight. It feels like there's limited motion compared to this one. This one hurts.
There still is. So then there's nothing that's changed. Is that correct?
No, still tender.
That's fine.
Painful.
Jeff, we just did your shoulder now with ozone, correct?
That's correct.
We did the back of your scapula, then we did the deltoid bursa because you had some lingering discomfort. Can you tell us how that's, move your shoulder around and tell us how it's doing?
Definitely affected it towards the positive. There's a little tenderness where this injection site is, but not where the problem was.
Okay. On a scale of 10, if you had 10 points of discomfort in there and 0 is 0, what would you give me?
Well, this would be a 0, my right
Right.
arm, and there's relief here. I would say it's down to 2.
That's really good.
Right, down
Especially
to 2.
because I put a needle in there and
Right,
you're going to
and
have some discomfort from that.
That's what I think it hurts. It hurts more at the injection site than it does inside the shoulder.
Okay, thanks.